my name is Valerie Davis. I'm a student nurse from OSUIT and I'll be performing a physical assessment. Does that sound good?
Yes.
First of all, I'm going to wash my hands. And then can you give me your name and date of birth?
Tai Han, May 9th, 1994.
Okay. I'll be doing a head to toe assessment, so I'll be starting with your scalp to check for any lesions, abnormalities, or infestations, and there are none. Next, I'm going to palpate your sinuses. Tell me if you feel any tenderness or pain. This is your frontal and your maxillary.
No.
Okay, next I'm going to inspect your eyes, which are equally round and symmetrical to your face. And I'm going to pull down on your eyelids as you look up. Your conjunctiva are pink and moist, and your sclera is white and moist. Next, I'm going to see how they react to light and accommodate. Good. Now if you could look at my pen, and look at the wall behind me, and back at my pen. Good. Now if you could just follow my pen. Good. Your pupils are equally round and reactive to light, and they accommodate. Now I'm going to check your nose. You can tilt your head up and flare your nostrils. Good. They flare symmetrically. Your septum is midline and non-deviated, and your mucous membranes are pink and moist. Next, I'm going to test your patency. I'm going to close one as you sniff, and the other. Good, no blockages. Now I'm going to check your mouth, starting with your lips, which are pink and moist with no cracks or lesions. If you could open your mouth, please. Lift your tongue side to side and say ah.
Ah.
Good. Your tongue, cheeks, and gums are pink and moist with no lesions. Your uvula and tonsils are intact and present, and your teeth are white and lined. Next, I'm going to check your auricles for any abnormal discharge or lesions, and there are none. Next, I'm going to palpate and tell me if you feel any tenderness or pain.
No.
Good. I also felt no enlargements. Next, I'm going to check your neck. If you could tilt up your head. Your trachea is aligned to your body, and your thyroid is normal with no enlargements or abnormalities. Next, I'm going to check your carotid artery. Good. I heard no signs of a bruit, which would indicate stenosis, which is narrowing of the vessel, and that could cause blockages. Now I'm going to inspect your anterior thorax. Your skin is consistent to the rest of your body. Your temperature feels normal, and there's no diaphoresis. If you could breathe in slowly and out. Good. Your chest rises and falls symmetrically, and you do not use your accessory muscles. Next, I'm going to auscultate your lung sounds. Good, I heard no crackles, bronchi, or wheezing. Now I'm going to check the valves of your heart, which are between the second and fifth intercostal space. So on the second intercostal space of your right side center is the aortic valve, and then on the left side of the second intercostal space is your pulmonic valve. Below that is your Erb's point, and below that is your tricuspid. And then on the fifth intercostal space, left of the mid-clavicular line is your mitral valve. And in the fifth intercostal space of the left of the mid-clavicular line is also your apical pulse, which is the point of maximum impulse. Now I'm going to check your posterior thorax. Your skin is consistent to the rest of your body. Your temperature feels normal, and there's no diaphoresis. And the curvature of your spine is normal. Now if you could breathe in and out slowly. fall symmetrically. Now I'm going to listen to your posterior lung sounds. Good. Now you could turn back around, please. Have you ever given yourself a breast exam?
No.
Okay, it is recommended that you do it at least once a month to check for any lumps or abnormalities. It is easier to do when you're lying down or in the shower with the water lubricating, so it'll make it easier. But right now I'm going to demonstrate with you how to give yourself a breast exam. You're going to start with your hand behind your head, and then with your fingers you're going to start at your axillary and make small circular motions. You're going to make a spiral to your nipple, and if you feel any lumps or abnormal discharge, you should contact your doctor as soon as possible. Now I'm going to check your upper extremities. Your skin is consistent to the rest of your body. Your temperature feels normal and there's no diaphoresis. I'm going to give you a little pinch on your skin to check your turgor. There's no tinting. If there were, that means you're dehydrated. And I'm going to check if your capillary refills within 3 seconds. And they do, and there's no clogging. Now I'm going to check your pulses, which is your brachial and your radial. They feel normal and are symmetrical. Next, I'm going to test your strength and range of motion. You could push up and push down. Good. And your ranges of motion are flexion, extension, abduction, adduction. Good. Now do that to both of your arms. Now, if you would, please lay down so I can inspect your abdomen. Okay. If you could breathe in slowly and out. Okay, there are no enlargements of your abdomen and it is flat and smooth. Now I'm going to auscultate your abdomen or your bowel sounds, and they can range from normal, hypoactive, hyperactive, and absent. If they're absent, I would have to listen for up to 5 minutes or until I hear bowel sounds. Now I'm going to auscultate them, and I'm going to start with your lower right quadrant, your upper right quadrant, your upper left quadrant, and your lower left quadrant. I heard bowel sounds from all 4 quadrants. Now I'm going to lightly and deeply palpate each quadrant. Your lower right, upper left, lower left. Now I'm going to deeply palpate and tell me if you feel any tenderness or pain.
No. 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 No.
Good. Now we're almost done, and I'm going to check your lower extremities. Your skin is consistent to the rest of your body, your temperature feels normal, and there's no diaphoresis. I'm going to check your capillary refills within 3 seconds, and they do. Next, I'm going to check your pulses. This is your posterior tibula pulse. This is your dorsal pedis pulse, and they feel normal and are symmetrical. Next, I'm going to test your strength and range of motion. If you could push up and push down. Good. Now, if you remember, your ranges of motion are flexion, extension, abduction, adduction. Good. Now you can put your items on, and you're all done.
Thank you.